The first topic of this class is what I call the nuts and bolts of community nutrition. It's an overview of the field of community nutrition. I want you to think about the communities you belong to and why or how you're linked with each one. I'm going to give you 1 minute to list those down on a piece of paper, or you can list it in your head and think about how you are linked to each one. So hopefully that gave you some time to think about communities that you belong to. And when I think about communities I belong to, there are a lot of different ones. I think about one community I belong to is the BYU community. I belong to the Department of Nutrition, Dietetics, and Food Science. All of you in this class belong to the NDFS 400 community. And beyond that, you can think about personal communities. You might live in a certain neighborhood or a certain apartment complex. You may be a community within your roommates, or maybe you're married, so your spouse and your family, that's your community. We're members of the Church of Jesus Christ of Latter-day Saints. That's another community that we can belong to. So there are lots of different levels of communities and different people that can be in those communities. So we think about, how do we define a community? I want you to think about all the communities you listed and how you're linked to that, and think to yourself, if you had to define community, how would you define it? What is community? If we look at the Merriam-Webster dictionary online, community has a lot of different definitions, as you can see listed here. So a unified body of individuals, such as people with common interests living in a particular area. It could be having a common characteristic or interest. It could be maybe have professional interests. It could be maybe you share a common history or a common social, economic, or political interests. Maybe you're linked together through a common policy. So these are all definitions through Merriam-Webster Dictionary of community. When you look at your book, they define community including 4 components. So including a group of people, location and space, social interaction, and shared values. So all of these things are components of community. And when you thought about your own communities that you belong to and why, I'm sure that some of these things came up, whether that was a group of people or you have shared values, or maybe there's some situations where you have all of these things within your community setting, all of these 4 components. When we think about community nutrition, it focuses on 3 areas, and you'll see throughout the class that we will talk about these 3 areas, and a lot of times they overlap. So the 3 P's of community nutrition, the 3 P's are people, policy, and programs. This next activity, it's listed as a team activity, but I will have you do it on your own, given that this is a video. And what I want you to do is I'm going to give you 2 minutes, and I want you to use the internet, your book, or your personal experience to list as many examples under each of these three areas that you can think of. So anything under people, anything under policy and programs, again, using these resources, it can be local, national, or global. So I'll go ahead and count down the 2-minute marker timer. So some of these may have been easier for you to find and to list than others, and there are a lot of different categories or ideas that could fall underneath each of these three P's. I'm just going to show you some of the ones I thought of myself. So in people, I did some generalities like life stage, whether it's pregnancy or child, older adult, something like that. It could be gender. Maybe it's the location where people are at. So it could be the people of Provo or Utah County or Utah or the United States. It could be maybe race or ethnicity. And the list could go on, and thinking about all the different ways you could think about people. Programs, some of the ones that are nutrition related that we'll talk about in this class, and this definitely is not an exhaustive list, but just ones that are off the top of my head. National School Lunch Program, School Breakfast Program, the Special Supplemental Nutrition Program for Women, Infants, and Children, Supplemental Nutrition Assistance Program, SNAP, or formerly known as food stamps, congregate meal programs for older adults, Meals on Wheels. Another one I thought of is Head Start. There's lots of different types of programs that serve people. So these programs serve people. I think the one that might be the harder one at this point in this class is thinking about policy. So programs are the actual what gets carried out and serves people, but these programs are kind of the administration is a program, but the legislation or the law that says that these programs can operate and how they should operate, that's policy. So for instance, the Healthy Hunger Free Kids Act outlines the policy and the law surrounding the National School Lunch Program, School Breakfast Program, and the Farm Bill is related to food stamps or SNAP. The Older Americans Act is related to congregate meals and Meals on Wheels. Social Security Act is another one that's related with Medicare. And then BYU Honor Code, which you all are aware of, that is also a policy. And there are many other policies. I haven't listed any kind of federal regulations here, which we'll talk about in this class, that when a law is written, then for nutrition programs, there's going to be regulations written. Essentially, regulations specify specifically how programs should be carried out. So these are definitely interrelated. Policy drives programs and how they're administered, and programs serve people. So all of these interact, and these are the three P's of community nutrition. Another concept in thinking about community nutrition is thinking about health promotion and then also thinking about intervention. So this is a chart from your book showing you that in all of these stages we can do health promotion, but there are essentially different types of prevention that we're looking at. Looking at primary prevention, which is in the orange, secondary prevention in the green, and then the disease management and tertiary prevention in the yellow. So there are things you can do at each of these stages that promote health, but they're going to be the kind of the impetus or the focus of that promotion is going to be different depending on which type of prevention we're in. So in the orange, we're looking at a well population, and primary prevention really is we're trying to promote healthy behaviors that are going to even prevent the occurrence or beginning or incidence of a disease. So let's say, we're going to promote high fruit and vegetable intake because of the phytochemicals and antioxidants that's going to help to prevent cancer from even developing. Okay, that's primary prevention. Secondary prevention, this is where we've got someone who is likely at risk to get a disease. So let's say you're at a health fair and you're doing some kind of screening, let's say for diabetes, and you find someone who has elevated blood glucose levels. Well, that person, you're going to promote, do health promotion through having them go to their doctor and to have further checkups to see whether or not they actually do end up getting diabetes. So maybe they have, maybe they even have pre-diabetes, so they're at risk for getting diabetes. But we can still do things, health promotion. Maybe there's things we can help with individuals who have let's say, elevated blood glucose, but not quite diabetes yet. We can help them to engage in healthful behaviors with eating and exercise. Now, tertiary, this is where this person now has established disease. So let's say they have hypertension or they have diabetes, and now we want to do some education or health promotion to try to prevent any further complications from occurring. So in this case, we're probably going, in the case of hypertension, if we have groups of people that we're concerned about, maybe we're going to do education in the community related to DASH diet kind of eating patterns. Maybe we're going to do some promotion in a grocery store to encourage people to choose healthier food items, and maybe specifically targeting those who already have disease states. Maybe there's dietitians in a grocery store and they're going to do a tour and do some education on how to manage that in a way through foods that are available in the grocery store. So again, it's just thinking about how do you give education or do health promotion activities, whether that's environmental or in a classroom setting or something with a group of people. How are you going to educate them in a way that helps them to not have further complications? So if you have questions about these different stages, definitely don't hesitate to ask. The last thing I want to talk about is who is a community nutritionist, just briefly. So thinking about what kind of qualifications do they have, where do they practice, what are their roles and responsibilities. Most community nutritionists are going to have a bachelor's degree. They may have a background in public health. A lot of them will be dietitians. We do have some nutritional scientists. Sometimes they have even public health nurses who take on that role if they don't have other qualified individuals for that position. Really depends on the state and the area that you're working as to what the qualifications are. You'll see in our guest speakers they have a diversity of backgrounds and education. Many are registered dietitians, but others are not. So you'll get a sense of the diversity of individuals working in the community nutrition realm. Practice settings are varied, so it can be from a local health agency to state or federal health agencies. It could be at a local organization. It could be at a school. It could be at a work site. It could be grocery stores. It could be maybe outpatient services with hospital or maybe something like WIC or working for Head Start, things like that. So really very diverse settings. Some might work in, again, corporate wellness. I guess I mentioned worksite, but that's corporate wellness. Some might do a consulting or advocacy work. So roles and responsibilities of community nutritionists really depend on the position they're in, but they can do things like managing budgets. They can be writing grants and writing budgets. Not just managing, but writing the budgets. They could be implementing programs or developing programs. They could be coming up with evaluation plans and carrying those out. They could be doing needs assessments. They could be following federal regulations to get reimbursement for meals served through like Head Start or through school meals or congregate meal programs or Meals on Wheels. They could be doing some assessments, education, management, advocacy work. There's a lot of things that community nutritionists roles that they can take on. So the rest of the semester, we're really going to focus on this process of events in community nutrition. So when I think about developing a new program or intervention, these are really the steps that you take. Conducting a needs assessment, which will have a whole section on what that means. Then taking the results of a needs assessment, kind of investigating something that's unknown and understanding that a little bit better leads into thinking about, well, how can we intervene or have a program to improve things within this population? And that includes program planning evaluation techniques. Most programs are going to require funding. So a lot of times, if the funding's not already within the institution organization, you're going to have to write for funding through external agency to fund the program you're developing. And then, of course, you're going to carry out the program or intervention, and then you're going to evaluate it and present the results to individuals who are interested in this, maybe other community members. Maybe it's going to go into research publication. There's different ways it might get disseminated. Maybe it's going to be to policymakers. And then across all of this is going to be managing and administrative, managing projects, managing resources, whether that's people or money, and then thinking about administration over people. So again, we'll be talking about each of these areas throughout the semester, and you'll get much more in-depth experience with each of these as you carry out your own community project. That's all for the nuts and bolts. Again, if you have questions, feel free to reach out to me.